Dr. Cutler here, your Colorado sinus specialist. I'd like to give you a brief introduction on what you should expect coming in to see me. When I see my patients here in the office, the goal is to listen to you, find out what your concern is, and try to address that concern with the latest and greatest techniques that are available to help you. So that starts with listening to you, hearing your concerns, and hearing your story as far as what type of difficulties you're having with your sinuses. In addition to that, the goal is to do a good physical examination, to look in the ears, look in the nose, look in the throat, and also likely put a small little camera in your nose called an endoscope to be able to see the anatomy in your nose, to see if there's any inflammation in your nose, see if there's any sign of any infection, and when necessary, get a culture, and to see if there's any abnormal looking anatomy. After looking through your nose and completing that physical examination process, there's other tests that we can consider when we work up someone with sinus conditions, and that might include allergy testing to see if there's something in the environment that could be triggering some of the inflammation or some of the problems that you might be experiencing. In addition to that, a very common test that we would order would be a CAT scan of your sinuses to look on the inside of your sinus and nasal cavity area to see if there's any abnormality there. And then the goal is to try to put that all together to have a tailored plan for you. And that always starts with good medical therapy. We always want to maximize our medical treatments for you prior to considering any surgical options. But if medical therapy is not effective in the treatment of your sinus and nasal conditions, there are surgeries that can be considered. And I'm happy to discuss this stuff with you in person. And thank you for your time.